The European health insurance card is issued free of charge and allows anyone who is insured by or covered by a statutory social security scheme of the EEA countries and Switzerland to receive medical treatment in another member state free or at a reduced cost, if that treatment becomes necessary during their visit, or if they have a chronic pre-existing condition which requires care such as kidney dialysis. The term of validity of the card varies according to the issuing country. The intention of the scheme is to allow people to continue their stay in a country without having to return home for medical care. As such, it does not cover people who have visited a country for the purpose of obtaining medical care, nor does it cover care, such as many types of dental treatment, which can be delayed until the individual returns to his or her home country. It only covers healthcare which is normally covered by a statutory healthcare system in the visited country, so it does not render travel insurance obsolete. The card was phased in from June 1, 2004 and throughout 2005, becoming the sole healthcare entitlement document on January 1, 2006. The card is applicable in all French overseas departments as they are part of the EEA, but not non-EEA dependent territories such as Jersey, the Isle of Man, Aruba or French Polynesia. However, there are agreements for the use of the EHIC in the Faroe Islands and Greenland, even though they are not in the EEA. The reason for the existence of this card is that the right to healthcare in Europe is based on the country of legal residence, not the country of citizenship. Therefore, a passport is not enough to receive healthcare. It is however possible that a photo document is asked for, since the European health insurance card does not contain a photo. In some cases, even if a person is covered by the health insurance of an EU country, one is not eligible for a European health insurance card. For instance, in Romania, a person who is currently insured has to have been insured for the previous 5 years to be eligible. It replaced the following medical forms: E110, for international road hauliers, E111, for tourists, E119, for unemployed people job seekers, E128, for students and workers in another member state. Third-party application processors, European health insurance cards are provided free to all citizens of participating countries. There are however various businesses who act as non-official agents on behalf of individuals, arranging supply of the cards in return for payment, often offering additional services such as the checking of applications for errors and general advice or assistance. This has proved extremely controversial. In 2010 the British government moved against companies that invited people to pay for the free EHIC, falsely implying that through payment the applicant could speed up the process. Despite this, the practice continues. Participating countries. As of 2013, 32 countries in Europe participate, the member states of the European Economic Area plus Switzerland. This coincides with the 28 member states of the European Union and 4 member states of the European Free Trade Association. The Channel Islands and Isle of Man do not supply coverage under the EHIC, and their residents are not eligible for EHICs. Controversy. In August 2015 the Daily Mail ran a story about abuse of the EHIC system in which a card was issued to its undercover Hungarian reporter who obtained the card after visiting the UK for less than 1 day after another journalist posed as her landlord and presented a GP with the tenancy agreement of a property that neither occupied in order to get an NHS number. It claimed that foreigners were charging the NHS for care in their own country. As The Guardian pointed out, the NHS issued a card to an individual that wasn't a unregistered trademark T eligible to receive the card because a GP was duped into issuing an NHS number, and it was unclear what benefit would accrue as a result. The Huffington Post later reported that only 9 instances of fraud involving EHIC had been discovered in 5 years, costing the British taxpayer a total of £712.56. See also, Healthcare in Europe. Italian health insurance card, Carte Vitale. References. External links, UK EHIC application, General UK EHIC information, EU site about the EHIC, Irish EHIC site, includes details of coverage in various countries, Dutch EHIC website, accessing healthcare in Switzerland, warning over health card renewals.